Myasthenia gravis. Myasthenia gravis comes from the Greek and Latin words meaning grave muscular weakness. The most common form of MG is a chronic autoimmune neuromuscular disorder that is characterized by fluctuating weakness of the voluntary muscle groups. Myasthenia gravis, MG, is a chronic autoimmune disorder in which antibodies destroy the communication between nerves and muscle, resulting in weakness of the skeletal muscles. Myasthenia gravis affects the voluntary muscles of the body, especially those that control the eyes, mouth, throat and limbs. The disease can strike anyone at any age, but is more frequently seen in young women, aged 20 and 30, and men aged 50 and older. A myasthenia gravis crisis can involve difficulty in swallowing or breathing. The cause of myasthenia gravis is unknown and there is no cure, but early detection and prompt medical management can help people live longer, more functional lives. When the first case of MG was documented in 1672 by Thomas Willis, an Oxford physician, not much was known or understood about it. Today, we know there are multiple causes for MG as well as treatment options. Myasthenia gravis, MG, is the most common primary disorder of neuromuscular transmission. The usual cause is an acquired immunological abnormality, but some cases result from genetic abnormalities at the neuromuscular junction. Much has been learned about the pathophysiology and immunopathology of myasthenia gravis during the past 20 years. What was once a relatively obscure condition of interest primarily to neurologists is now the best characterized and understood autoimmune disease. A wide range of potentially effective treatments are available, many of which have implications for the treatment of other autoimmune disorders. What happens in your body? The voluntary muscles of the entire body are controlled by nerve impulses that arise in the brain. These impulses travel down the nerves to the place where the nerves meet the muscle fibers. Nerve fibers do not actually connect with muscle fibers. There is a space between the nerve ending and muscle fiber, called the neuromuscular junction. When the nerve impulse originating in the brain arrives at the nerve ending, it releases a chemical called acetylcholine. Acetylcholine travels across the space to the muscle fiber side of the neuromuscular junction where it attaches to many receptor sites. The muscle contracts when enough of the receptor sites have been activated by the acetylcholine. For someone with MG, there can be as much as an 80% reduction in the number of these receptor sites. The reduction in the number of receptor sites is caused by an antibody that destroys or blocks the receptor site. Antibodies are proteins that play an important role in the immune system. They are normally directed at foreign proteins called antigens that attack the body. Such foreign proteins include bacteria and viruses. Antibodies help the body to protect itself from these foreign proteins. While it is not still fully understood why, the immune system of the person with MG makes antibodies against the receptor sites of the neuromuscular junction. The antibodies destroy the receptor sites more rapidly than the body can replace them. Muscle weakness occurs when acetylcholine cannot activate enough receptor sites at the neuromuscular junction. When it comes to diagnosing MG, abnormal antibodies can be measured in the blood of most people with MG, but not all. What causes myasthenia gravis? Myasthenia gravis is not inherited and it is not contagious. It generally develops later in life when antibodies in the body attack normal receptors on muscle. This blocks a chemical needed to stimulate muscle contraction. A temporary form of myasthenia gravis may develop in the fetus when a woman with myasthenia gravis passes the antibodies to the fetus. Generally, it resolves in 2 to 3 months. What are the symptoms of myasthenia gravis? These are the most common symptoms of myasthenia gravis. Visual problems, including drooping eyelids, ptosis, and double vision, diplopia. Muscle weakness and fatigue may vary rapidly in intensity over days or even hours and worsen as muscles are used, early fatigue. Facial muscle involvement causing a mask-like appearance, a smile may appear more like a snarl. Trouble swallowing or pronouncing words, weakness of the neck or limbs. The symptoms of myasthenia gravis may look like other conditions. Always see your doctor for a diagnosis. Flare-ups and remissions, easing of symptoms, may occur now and then during the course of myasthenia gravis. Remissions, however, are only rarely permanent or complete. How is myasthenia gravis diagnosed? Your doctor can diagnose myasthenia gravis based on your symptoms and certain tests. During the physical exam, your doctor will ask about your medical history and symptoms. A common way to diagnose myasthenia gravis is to test how you respond to certain medicines. Muscle weakness often dramatically improves for a brief time when you are given an anticholinesterase medicine. If you respond to the medicine, it confirms myasthenia gravis. Other tests that may be done include blood tests. These tests look for antibodies that may be present in people with myasthenia gravis. Genetic tests. These tests are done to check for conditions that run in families. Nerve conduction studies. A test called repetitive nerve stimulation is used to diagnose myasthenia gravis. Electromyogram, EMG, a test that measures the electrical activity of a muscle. An EMG can detect abnormal electrical muscle activity due to diseases and neuromuscular conditions. How common is myasthenia gravis? MG affects about 20 out of every 100,000 people. Experts estimate that 36,000 to 60,000 Americans have this neuromuscular disease. The actual number of people affected may be higher, as some people with mild cases may not know they have the disease. Who might get myasthenia gravis? MG mostly affects women aged 20 to 40 and men aged 50 to 80. About 1 in 10 cases of MG occur in teenagers, juvenile MG. The illness can affect people of all ages but is rare in children. These factors increase risk. History of other autoimmune diseases, such as rheumatoid arthritis and lupus. Infections. Medications for malaria, heart arrhythmias and cancer. Surgical procedures. Thyroid disease. What are the types of myasthenia gravis? Autoimmune MG is the most common form of this neuromuscular disease. Autoimmune MG may be ocular, the muscles that move the eyes and eyelids weaken. Your eyelids may droop, or you may not be able to keep your eyes open. Some people have double vision. Eye weakness is often the first sign of MG. Nearly half of people with ocular MG evolve into the generalized form within 2 years of the first symptom. Generalized, muscle weakness affects the eye and other body parts such as the face, neck, arms, legs and throat. You may find it difficult to speak or swallow. Lift your arms over your head, stand up from a seated position, walk long distances and climb stairs. How does myasthenia gravis affect pregnancy? In rare instances, pregnancy brings on MG symptoms for the first time. If you already have MG, symptoms may worsen during the first trimester or immediately after childbirth. In some patients, MG symptoms improve during pregnancy. Certain MG treatments are not safe during pregnancy or breastfeeding. Your healthcare provider can guide you through this time, ensuring a healthy pregnancy. Is myasthenia gravis inherited? In general, autoimmune MG isn't inherited. It's rare for more than one member of the same family to receive a diagnosis of autoimmune MG. The non-autoimmune form of MG, also called congenital myasthenic syndrome, can affect more than one member of the same family. A pregnant woman cannot pass MG to her infant. However, about 1 in 10 babies born to women with MG develop a temporary condition called neonatal myasthenia. These infants may have weak cries or sucking reflexes at birth. These symptoms go away in a few weeks. This condition doesn't increase a child's risk of developing MG in the future. What is the connection between thymus gland problems and MG? Many people with MG have thymus gland conditions that may bring on MG. The thymus is a small organ in the upper chest that is part of the lymphatic system. It makes white blood cells that fight infections. Thymus gland. 2/3 of young people with MG have overactive thymic cells, thymic hyperplasia. About 1 in 10 people with MG have thymus gland tumors called thymomas, which may be benign, not cancer, or cancerous. Diagnosis of myasthenia gravis. Your doctor will review your symptoms and your medical history and conduct a physical examination. Your doctor might use several tests, including neurological examination. Your doctor may check your neurological health by testing reflexes, muscle strength, muscle tone, senses of touch and sight, coordination, balance. Tests to help confirm diagnosis of myasthenia gravis might include ice pack test. If you have a droopy eyelid, your doctor might place a bag filled with ice on your eyelid. After 2 minutes, your doctor removes the bag and analyzes your droopy eyelid for signs of improvement. Blood analysis. A blood test might reveal the presence of abnormal antibodies that disrupt the receptor sites where nerve impulses signal your muscles to move. Repetitive nerve stimulation. In this nerve conduction study, doctors attach electrodes to your skin over the muscles to be tested. Doctors send small pulses of electricity through the electrodes to measure the nerve's ability to send a signal to your muscle. To diagnose myasthenia gravis, doctors will test the nerve repeatedly to see if its ability to send signals worsens with fatigue. Single fiber electromyography, EMG. This test measures the electrical activity traveling between your brain and your muscle. It involves inserting a fine wire electrode through your skin and into a muscle to test a single muscle fiber. Imaging of myasthenia gravis. The doctor might order a CT scan or an MRI to check if there's a tumor or other abnormality in your thymus. Pulmonary function tests. These tests evaluate whether your condition is affecting your brain. Treatment of myasthenia gravis. Various treatments, alone or in combination, can relieve symptoms of myasthenia gravis. Your treatment will depend on your age, how severe your disease is and how fast it's progressing. Medications of myasthenia gravis. Cholinesterase inhibitors, medications such as pyridostigmine enhance communication between nerves and muscles. These medications aren't a cure, but they can improve muscle contraction and muscle strength in some people. Side effects. Possible side effects include gastrointestinal upset, diarrhea, nausea, and excessive salivation and sweating. Corticosteroids. Corticosteroids such as prednisone inhibit the immune system, limiting antibody production. Prolonged use of corticosteroids, however, can lead to serious side effects, such as bone thinning, weight gain, diabetes and increased risk of some infections. Immunosuppressants. Your doctor might also prescribe other medications that alter your immune system, such as azathioprine, mycophenolate mofetil, cyclosporin, methotrexate or tacrolimus. These drugs, which can take months to work, might be used with corticosteroids. Side effects of immunosuppressants, such as increased risk of infection and liver or kidney damage, can be serious. Intravenous therapy. The following therapies are usually used in the short term to treat a sudden worsening of symptoms or before surgery or other therapies. Plasmapheresis. This procedure uses a filtering process similar to dialysis. Your blood is routed through a machine that removes the antibodies that block transmission of signals from your nerve endings to your muscles' receptor sites. However, the good effects usually last only a few weeks, and repeated procedures can lead to difficulty accessing veins for the treatment. Risks associated with plasmapheresis include a drop in blood pressure, bleeding, heart rhythm problems or muscle cramps. Some people develop an allergic reaction to the solutions used to replace the plasma. Intravenous immunoglobulin, IVIG. This therapy provides your body with normal antibodies, which alters your immune system response. Benefits are usually seen in less than a week and can last 3 to 6 weeks. Side effects, which usually are mild, can include chills, dizziness, headaches and fluid retention. Monoclonal antibody. Rituximab and the more recently approved eculizumab are intravenous medications for myasthenia gravis. These drugs are usually used for people who don't respond to other treatments. They can have serious side effects. Surgery for myasthenia gravis. Some people with myasthenia gravis have a tumor in the thymus gland. If you have a tumor, called a thymoma, doctors will surgically remove your thymus gland, thymectomy. Even if you don't have a tumor in the thymus gland, removing the gland might improve your myasthenia gravis symptoms. However, the benefits of thymectomy can take years to develop. A thymectomy can be performed as an open surgery or as a minimally invasive surgery. In open surgery, your surgeon splits the central breastbone, sternum, to open your chest and remove your thymus gland. Minimally invasive surgery to remove the thymus gland uses smaller incisions. It might also involve video-assisted thymectomy. In one form of this surgery, surgeons make a small incision in your neck or a few small incisions in the side of your chest. They then use a long, thin camera, video endoscope, and small instruments to see and remove the thymus gland. Thymectomy. Robot-assisted thymectomy. In this form of thymectomy, surgeons make several small incisions in the side of your chest. They remove the thymus gland using a robotic system, which includes a camera arm and mechanical arms. These procedures might cause less blood loss, less pain, lower mortality rates and shorter hospital stays compared with open surgery. Lifestyle and home remedies. To help you make the most of your energy and cope with the symptoms of myasthenia gravis. Adjust your eating routine. Try to eat when you have good muscle strength. Take your time chewing your food, and take a break between bites of food. You might find it easier to eat small meals several times a day. Also, try eating mainly soft foods and avoid foods that require more chewing, such as raw fruits or vegetables. Use safety precautions at home. Install grab bars or railings in places where you need support, such as next to the bathtub or next to steps. Keep your floors clean, and move area rugs. Outside your home, keep paths, sidewalks and driveways cleared of leaves, snow and other debris that could cause you to stumble. Use electric appliances and power tools. To help you maintain your energy, try using an electric toothbrush, electric can openers and other electrical tools to perform tasks. Wear an eye patch. If you have double vision, an eye patch can help relieve the problem. Try wearing one to write, read or watch television. Periodically switch the eye patch to the other eye to help reduce eye strain. Plan. If you have chores, shopping or errands to do, plan the activity for when you have the most energy. Coping and support. Coping with myasthenia gravis can be difficult for you and your loved ones. Stress can worsen your condition, so find ways to relax. Ask for help when you need it. Learn all you can about your condition, and have your loved ones learn about it as well. You all might benefit from a support group, where you can meet people who understand what you and your family members are going through. Preparing for your appointment. You're likely to first see your family doctor, who will then refer you to a doctor trained in nervous system conditions, neurologist, for further evaluation. Here's information to help you get ready for your appointment. What you can do. Take a friend or family member along to help you absorb the information you're given. Make a list of your symptoms and when they began. All medications, vitamins or supplements you take, including doses,